Hi there, this is Dr. Jack Mutnick at Renew Med Spa Plus Wellness. I am a specialty trained internal medicine physician, and I did fellowship training in allergy, asthma, and immunology. I have been taking care of primary care and specialty care, adult and pediatric patients for upwards of 20 years. I have my own wellness clinic. We do not take insurance, and so I am not beholden to these insurance companies and trying to answer questions based on what they want us to say. You will get honest, true, and real answers from me. So today I want to talk about the triple receptor Retatrutide. Some people call it Retatrutide. I call it Retatrutide. It is a triple receptor medication that is incredible at focusing on obesity, overweight, weight loss, where people are losing over a 68 to 72 week period up to 25% of their body mass index, which is unbelievable. Now, this medication also has other far-reaching benefits, as most of these GLP-1 medications do. There is semaglutide. Semaglutide is the single GLP-1 receptor. It is a fabulous medication. Personally, I used semaglutide for my weight loss journey. I lost 70 pounds over 8 months. Now, taking that into account, that also included focusing on diet and exercising, aerobic exercise 3 to 4 times per week. There is also tirzepatide, which is the dual receptor, GLP-1, GIP. Retatrutide now is the triple receptor. It works on the GLP-1, the GIP, and the glucagon receptor. And why this is so significant is that the GLP and the GIP work to slow down the gut, so that way you feel full longer, which sends a signal up to your brain that says, look, you don't need to keep eating. And if you do, you're going to feel bloated, nauseous, you're not going to feel good. And so you feel full longer. They state that you will reduce your caloric intake by about 40% with the use of these medications. Now, why the glucagon receptor is so important is that now this stimulates adipose or fat cell metabolism. So this is stimulating your own fat cells to metabolize, to use that energy and burn that instead of protein, muscle. It does obviously use other ways of burning calories and burning fat, but this is the significant step why there is even more weight loss. Now, Retatrutide is in the same family as these GLP-1, so it also provides significant benefit in treating non-alcoholic fatty liver disease, which is a huge component of being overweight and obesity. These are sugar medications. It treats diabetes. It treats hyperglycemia. And as we say that at the same time, these medications also treat high blood pressure and high cholesterol. Why? Well, first of all, we're eating less, but second of all, as you lose weight, your blood pressure improves, your cholesterol improves. It's the first thing that your doctor tells you. You need to lose weight. Of course, coming from your fat doctor, that's another issue. They should be doing it, but nevertheless, this is another benefit. Now, tirzepatide has been approved for obstructive sleep apnea, which honestly, all of these medications are effective for that. They have been shown to also reduce the risk of Alzheimer's dementia by up to 70%. That is significant. We also have the benefits of these medications are even looking at them. They're doing specialty studies on alcohol and opioid addiction because it reduces those craving receptors in the brain as well. And then even lastly, they're looking at them for female fertility because it really does normalize many of the hormones and the menstrual cycle in women. And lastly, even in asthma, because the GLP-1 receptor is the third most prevalent receptor in the lungs. So these are the first medications in an incredibly long time. I remember when I was in medical school when fen-phen was the drug of choice. But of course, that led to mitral valve disease and destruction. And so people lost weight, but then they had to have a valve replaced. These medications are incredibly safe. Now, when we talk about retatrutide, it is special because of that triple receptor. And so that triple receptor is effective in not only slowing down your gut, but metabolizing those adipose, those fat cells. Now, you must also focus on, because you are taking 40% less calories, I want you to think about you need to supplement with vitamins, meaning a multivitamin at least every day and vitamin D. Anything extra that you want to take is up to you, but a daily multivitamin and vitamin D. You also need to focus on hydration. Hydration is essential. Now, retatrutide is not out at the pharmacies yet. And the main reason is because the company is trying to ramp up enough of these pens so that they can overcharge the public, have their insurance refuse them, and create madness because it's going to sell out within the first sellout. It's crazy to say that about a medication, but it's going to be unavailable within the first few days, especially as wealthy people decide that they're just going to pay out of pocket for it. Now, you can obtain these through reputable companies, such as our place, for through compounding pharmacies, which have this medication and are compounding it available now. So you have a triple receptor retatrutide, which is available. Do I recommend that you start with this? Maybe, maybe not. It just depends. The nice thing about retatrutide is it has a much lower side effect profile than definitely semaglutide. Semaglutide has about 40% nausea in the clients that we see. So I experienced it too when I used semaglutide, but it does tend to go away, but that's an important thing. If you deal with nausea, you want to hydrate. You want to make sure that you're taking in enough protein, even if it means you have to focus on amino acids as a supplement. And then also sometimes we have to split the doses where you'll still be on that same dose in a week, but we do it like every Monday and Friday or every Tuesday and Saturday. We split it up. Tirzepatide has quite a bit less of the nausea and that side effect, but retatrutide really has the lowest, where people are really tolerating it excellent and they're getting the benefits and the results. Now, I have seen some people talking about, oh, you should boost it you should stay on the lowest dose for this period of time and then the medium dose for 12 weeks. There's no truth to that. The dosing it's a once a week injection. You boost it every 4 weeks. The dose. Typically we start at 2 milligrams. 4 weeks later, we go up to 4 milligrams. We go to 6, 8, 10, 12. The max dose you can go up to is 15. I have not found a lot of people who need to be on 15 milligrams. But again, everybody is different and different people will need different doses. Of course, weight loss is variable as well. But if you will exercise, you will have positive results. This just gets you over that speed bump, that plateau where you're dieting and you're exercising, but you just can't get to where you want. And it's really frustrating. I would recommend that you take a look at my other older videos that are years old, and you will see Dr. Jack Allergy, who's 221 pounds. That was me before I did semaglutide, before I did these GLP-1 medications, and they are incredibly effective. They work. You'll see the difference. Now I'm down 80 pounds because I continue to exercise. I still watch my diet. I just don't eat as much, but I eat what I want. I just focus on calories. I take a daily multi. I take vitamin D. Retatrutide is a fabulous triple receptor medication that is safe and incredibly effective. I would love to answer questions, assist, and even provide you with this medication. If you want to check us out online, you can find us Renew Med Spa Plus Wellness. I'm Dr. Jack Mutnick. I'm excited to be making more of these videos to talk about these GLP-1 medications, the single, the dual, the triple receptors, the newer ones, something known as cagrilintide, which is a dual amylin and calcitonin receptor agonist, talking about survodutide, which is in phase 2 studies, which is a GLP-1 and a glucagon receptor agonist. I am excited to talk about this and to provide my information for you to make an educated and smart decision about how you want to go about bettering your health. Have a wonderful and blessed day.